And tonight after class, we will have a guest speaker of Dr. Stuart Robertson, along with Dr. Tiffany Ford, to talk a little bit more about the MPH program. What do we know? So you can come in, it's an informational, so that we were going to cover topics around, is public health a good fit for me? What is the curriculum like? What are some career pathways? And then the admission requirements in any Q&A. Next slide. Thanks again, everyone, for joining us today on Conducting Oral Histories Action Lab with Jacqueline Luciano. Jacqueline Luciano is one of Long COVID Justice narrative architects in partnership with Dr. Breer's Oral History Project. Listening for the Long Haul, a living history of Long COVID, she is a first-generation Filipino-American mother of two and wife. She's also a former Illinois Department of Public Health surveillance nurse and working as a regulatory consultant until she became disabled by long COVID and associated disease. In January 2022, Jackie has experienced firsthand the gaslighting and challenges of navigating a complex healthcare system, especially as long COVID and myalgic and encephalomyelitis still has no FDA-approved treatments. This inspired her to share her story to help reshape public health narratives and policies that have traditionally neglected disabled people and people with complex chronic conditions, so that people with lived experience are believed, included, and respected. Jackie holds a Bachelor's of Science in Nursing from Loyola University Chicago. Since receiving beneficial modalities for her own lymphatic system, she aspires to study and be a holistic person-centered certified lymphatic practitioner. Long COVID Justice, LCJ, a project of strategies for high impact, are leading grassroots collective efforts to confront the long COVID crisis while centering racial, social, economic, and disability justice. Their work is done by and for chronically ill and disabled people and families. And with that, I pass it over to Jacqueline. Thank you. Welcome.
Thank you, Yvette. Thank you so much. All right, I'm going to share my screen now.
It's a touchy situation.
Okay, can you see this?
Yes, we could see it.
Okay, great. Okay, thanks. All right, so thank you again, Yvette, and staff here for the introduction and for having me here. It is such an honor and privilege. And I was wondering, did anyone have any pie today? For the math enthusiasts, happy Pie Day. Today is 3/14. Let me see. Please share any pie flavors that you had today. And before I begin, I would like to thank each and every person here today. Thank you so much for being here. Now, please excuse me. I will now turn off my camera because I do struggle with sitting upright and I have really bad, my vision gets blurry. So I'll turn it off for now, but I'll turn it back on later when we do the activity. Thank you. Okay. I would like to add a disclaimer that what I will share this evening is about my personal experience living with long COVID. Content shared does not contain any medical advice and is for educational purposes only. Also a warning that some content may be triggering, as I will be discussing loss, grief, loneliness, and hope, as seen in this long COVID ribbon. With that said, I invite all of us to take a long, deep breath and pause as we share an evening together of listening, reflection, and dialogue. The agenda for this lecture will include a quick intro to the following: long COVID and associated diseases, my experience living with long COVID justice and advocacy organizations, and how I became involved with oral history. If you were in attendance last week, you met the amazing Dr. Jennifer Breyer, and I'll call her Jenny for this presentation, and you all will have a sneak preview of their oral history project, Listening for the Long Haul. Our action lab will also build on from last week's lecture, and we will reflect, have an open dialogue, and create a timeline together to gather some thoughts, dates, and events that matter to you and your projects. Lastly, we will end with any final questions. First, let's begin with a poll, as I would like to get a general consensus of the audience here today. Yes or no, prior to this class, were you aware of long COVID? In the chat, feel free to share what you know or didn't know about long COVID, and we will discuss this during the hour. And Emily or Katie, if you have the results, let me know.
So I wasn't able to start the official poll, but it looks
Okay.
like lots and lots of yeses and a couple no's here and there.
Okay,
All too
great.
aware of it, living with it. Yes, my mom has suffered from long COVID. Lots of
Wow.
yeses.
Wonderful. All right. Well, thank you. Thank you for sharing that. And I hope we can all learn together today. Thank you. For those who didn't know, I would like to start off with a brief definition. So did you know that the term and hashtag long COVID was developed by a patient named Dr. Elisa Perego? She tweeted hashtag long COVID to describe her experience while not recovering from COVID-19. Wow. May 2020 was the beginning of a patient collective advocacy movement to bring awareness and change medicine. I also wanted to know if anyone got to watch any of the long COVID videos. I'd like to hear your thoughts about the educational videos compared to the CDC's definition. Now, for participants who didn't review the videos, that's okay. I'll explain the complicated definition. According to the CDC, some people who have been infected with the virus that causes COVID-19 can experience long-term effects from their infection, known as long COVID conditions. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. According to the CDC, long COVID is a patient-created term broadly defined as signs, symptoms, and conditions that continue or develop after initial SARS-CoV-2 infection. The signs, symptoms, and conditions are present 4 weeks or more after the initial phase of infection, may be multisystemic, and may present with a relapsing, remitting pattern and progression or worsen over time, with the possibility of severe and life-threatening events, even months or years after infection. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes and different sets of risk factors and outcomes. Now, remember Dr. Ford's presentation when she mentioned federal and state websites flunked COVID-19 reading level review? I learned that this website shouldn't be higher than an 8th grade reading level, yet it's complicated. That's why I shared the videos as prep to try and get a simpler idea of long COVID and complex chronic diseases. In short, the definition of a long hauler is you're screwed, there's no help to get to the root causes, and there's no tests or treatments available to help you. The CDC removed more safety precautions just 2 weeks ago. Doesn't encourage one to isolate or test so that a person wouldn't even know they had COVID to begin with. and will be blamed for any ongoing symptoms. The only way to prevent long COVID is by avoiding COVID. So what happened to our public health? Thanks to C19 Lab, known as COVID-19 Long Hauler Advocacy Project, for these educational graphics. These are a list of associated conditions and diseases. I have at least 8 of these, which many doctors and healthcare workers do not even consider or believe, and are quick to recommend a psych referral. I'll be discussing more of these in detail shortly. Who are the most affected by long COVID? Racial and ethnic minority groups have been the hardest hit, especially for Indigenous, African American, and people of color. This slide is from the Recover study here at UIC. There are over 200 symptoms reported in long COVID, and this isn't an exaggeration. Every patient needs to be screened for post-exertional malaise. This is also known as post-exertional symptom exacerbation. My symptoms worsen even from the slightest mental, physical, or emotional stimulation. There are articles lying that say this is based on a person's effort preference. Anyone experiencing this health has called out the BS. During my acute infection, I was prescribed to go outside for a walk and work out my activity. After continuing to work and push through, I had stroke-like symptoms, a fever for 8 weeks, and ended up bedbound for days with no treatment or help from providers. So what do all of these descriptions and definitions mean about long COVID regarding quality of life? What do these definitions translate to? Well, allow me to tell you about my story. In the middle of March 2020, when the world shut down due to the pandemic, my corporate position changed to hands-on help where needed. Nursing home residents were not allowed any visitors at all. I assisted with bed baths, meals, and basically became an infection preventionist to track the spread and to train staff on how to prevent the spread of COVID-19. And let's not forget, various public health agencies refused to acknowledge at the time that SARS-CoV-2 is an airborne virus. I had direct exposure to COVID around April 2020. I had COVID-like symptoms, and due to limited testing, I do not know if I had an infection, but was required to isolate. After 14 days, I had to return to work despite being fatigued. As the months went by, the long anticipation of vaccines arrived. I had conflicting feelings. I knew deep down I had chronic conditions that I was suffering with since I was a teenager, but was thankfully in remission. I didn't know what I had, but doctors told me that it was just anxiety and stress, despite suffering more than that internally. But as a nurse, we are generally obligated to get vaccines, and this was mandated for my job. So I told myself, I need to protect myself and others. Plus, we were told the vaccines were safe and effective. January 2021, I received 2 doses of the Pfizer vaccine. After the first dose, I had an immediate experience of a rapid heart rate, dizziness, hot flashes, and felt like I had the flu for days. By the second dose, I still developed flu-like symptoms, worsening migraines over several months, and felt like I had a mild case of Bell's palsy. That's where the left side of my face felt partially paralyzed, droopy, and I actually would drool on the left side of my mouth. I kept pushing through because all my colleagues where I received the vaccine said I was the only one who had any side effects, probably implying it was all in my head. Plus, I was needed more than ever as a nurse, especially with multiple infection control, public health inspections, and I needed to make sure COVID units were set up properly. November 2021, I received the booster and I had such a hard time walking and severe joint pain, but the push for vaccine and my job was ongoing, and the Delta variant was changing to Omicron. Since the rollout of vaccines, I will say I did see a decrease in deaths and hospitalizations. The spread was not as pervasive, and this was the narrative being pushed. But by December 2021, I was shocked to learn I had a positive COVID PCR test, especially after receiving a booster. I experienced breathlessness, disabling fatigue, cough, fever, rapid heart rate, brain fog, unrefreshing sleep, pain, and more. After I isolated during the infectious phase, I kept wondering what was going on and why wasn't I getting any better? Was this the definition of mild? Waking up every morning feeling like I've been poisoned, my muscles feeling like I ran for miles and miles. I was barely able to stand or speak correctly. Hours turned into days that turned into weeks, then months, and now years. What happened to preventing serious illness? Where was and is the long COVID public health messaging? I lost my job. I lost our family's health insurance plan. I lost my sense of taste and smell and my mind. I lost a lot of hair. I lost my ability to properly care for myself and my kids. I peed on myself twice in public. I've been absent as a wife, absent as a mom, absent as a daughter, a sister, a friend, an aunt, and godmother. There are many, many hours and days I spend time being horizontal, meaning lying down, and I have to keep my activities to a minimum because gravity and any extra physical or cognitive exertion makes my symptoms worse. I've spent over 2 years now trying to find answers. I've been gaslighted, mistreated, and not believed. But thankfully, I have found a few holistic practitioners and caring doctors to help manage my symptoms, but there's got to be more help and support. In partnership with the American Heart Association and 9-Panel Project, they asked long haulers to share stories, and I was partnered with an amazing artist, Kayla Banks, who created my silent comic. I hesitated to participate, so I asked, will my experience be included? Because I will be discussing the possibilities of my vaccine injuries. And will the American Heart Association believe me or refute my side effects? A previous COVID exposure of mine and an uncertain COVID infection plus vaccines exacerbated my underlying dysautonomia, which I have POTS, which is postural orthostatic tachycardia syndrome. This causes my heart rate to be 30 to 40 beats per minute faster when I change positions. And this worsens my brain fog, my fatigue, and my weakness. This is also why some days I can walk and others I can't even sit up. I was misdiagnosed throughout my 20s and was told I was just stressed and anxious, especially because I had a son. But kindly understand, I respect anyone's belief and or decision to get vaccinated or not. And I'm not anti-vaccine, but I believe safe protocols and dosages need to be researched and one's immune system, and if applicable, a patient's menstrual cycle status should be assessed. There are also many people who think that long COVID is simply vaccine injury. Well, that's not true at all. There are millions of long haulers who developed long COVID way before the vaccines were rolled out. And many long haulers are celebrating their 4-year anniversary. And don't forget when the hashtag long COVID was developed, May 2020. I recently opened the silent comic book I received last year, and I was shocked to see that I was actually on the front cover. So let's challenge and change public narratives. Let's have open, transparent, difficult conversations that affect public health. So who also helped save my life? Various advocacy organizations and people sharing personal testimonies online. Long COVID Justice is leading grassroots collective efforts to confront the long COVID crisis. I wasn't getting anywhere with conventional medicine. I went to Twitter, which is now known as X, and I found tweet after tweet discussing long COVID and side effects. I felt seen, I felt heard. And by reading about interventions that helped or not helped for others, I was able to learn and investigate what was going on in my body. But why is the burden placed on the patient? Thanks to their collective wisdom, and especially the founders of Long COVID Justice's experience with the HIV pandemic and ME action that has been understudied and underfunded, I have learned a lot and still learning more. ME is myalgic encephalomyelitis, which is a complex, chronic, neurological inflammatory disease, and one can learn more with the hashtag #MillionsMissing. And thanks to Jenny and Long COVID Justice and the staff here with Epidemics of Injustice, I am here presenting today, and I'm excited that there's a radical public health here. Did anyone get to review the letter from Long COVID Justice? If not, no worries, that's okay. The letter here is titled Pandemics Are Chronic, a statement of commitment to long COVID justice. This letter discusses that the COVID-19 pandemic, just like polio and HIV, leads to disability and chronic disease. And disabled and chronically ill people need to be included in policymaking and healthcare. In my experience being in the long-term care industry and regulatory department, I followed weekly public health webinars to develop and implement policies and procedures in the nursing homes. And this was not being discussed at all. The letter notes the design and application of public policies is profit over people. Disabled and chronically ill people were treated as expendable. They were othered in the language of prevention, treatment, and recovery. During last week's class, it was mentioned and identified that history keeps repeating itself. Well, that's the same with pandemic responses and lack thereof. The AIDS pandemic was ignored for years while thousands died. This is devastating to live through and experience. How can we go on like this? Please feel free to share your thoughts in the chat. Long haulers face many barriers to long COVID care and support, are struggling to manage disabling symptoms, lack access to clinical care, lack treatment solutions, and there's no economic support. I haven't been able to consistently function due to my current disability. My household is definitely feeling the loss of my former self and my income. This past January, I tried to stop many of my supplements and weekly treatments as the costs and debt keep piling up, but I had my worst relapse yet during and it was my 2-year anniversary. I fell on the floor when trying to get out of bed, and I yelled to call for my husband. He came to my side. He couldn't help me up, because I was partially paralyzed, where I couldn't sit or stand up. I felt like I was not getting any oxygen or circulation to my brain and my joints. And my husband helplessly sat there by my side for 2 whole hours until he could help move me. Here's an article I also shared titled COVID Long Haulers Protest in DC. Pandemics are chronic. And tomorrow is actually Long COVID Awareness Day. And there's actually a scheduled protest in Washington, DC tomorrow. This article was nice to read and review with Jenny's oral history project, History Moves. The empty beds displayed in Washington symbolizes the millions of patients with chronic illnesses who have gone missing from their lives and society. Gabriel San Emeterio, co-founder of Long COVID Justice and also a narrative architect, discusses recalling their experiences advocating in the HIV movement and how the HIV community won the passage of the historic Ryan White Act, the law passed in 1990 that now authorizes programs totaling more than $2 billion for life-saving care for HIV. The parallels between the AIDS and long COVID pandemics are sickening. It's evident long COVID is a public health crisis. Long COVID can happen to anyone, including children, and especially with repeat infections. You don't see many of us because we are confined to our beds. One can't discuss COVID without mentioning long COVID. And governments trying to erase us and play pretend doesn't mean we don't exist. To this day, there are no blood tests, established treatment protocol, or advanced testing that is known to specifically help long haulers. Women especially are gaslighted, and this goes back to the history of women's health not being studied and attributed to hysteria. Last week, Jenny mentioned a question that I also had prepared. What do you think of when you hear the word history? Type in the chat or kindly raise your hand to speak. I'm going to now check the participants if anyone would like to speak. Katie or Emily, do you have any answers for history?
One person says a story. History is a
nice.
pattern of behaviors. Oral history is intimate history, one that helps you to feel the impact more than you would by just reading about it. The stories of what took place to get us to where we are. History can help find solutions. When I think of history, I think of cause and effect because the history we have lived through always has some form of answer of questions we have today.
Wow, those are beautiful. And when I think of history, I remember my 8th grade teacher when he talked about history and broke up the word his story. And I actually like the hashtag her story. And oral history reminds me about your story. Oh, and I saw this one comment. History is the foundation upon which we are built. That's so true. And for those who read, I love this quote from Let This Radicalize You. History, as Di Prima said, is a living weapon.
Becky, do you mind actually moving the chat box just because it's
Oh,
blocking
yeah.
part of
Oh,
the
is it
screen?
there? Oh, sure.
Yeah, I
Thank
don't
you.
know why we can see it for some reason. Thank you.
Oh, okay. Thank you. I'm going to have chat off now. So then if you can read off any other last minute or any, sorry, not last minute, any other responses for his story. I think there was one more I was about to
Mhm.
read.
One last one. When I think of
Yeah.
history, I think of storytelling, of context, and of explanations for today.
That's beautiful responses. And now I'm going to move on to talking about long COVID and oral history. And then we're going to be getting into our action lab shortly. So thank you. So thanks to Jenny and long COVID justice. Listen, sorry, my mouse. Okay, listening for the long haul is a public history project examining how public history can be useful in producing policies that are more responsive to individual and community needs in the face of pandemics and mass disabling events, and in the process, make us all healthier and more resilient. When Jenny was mentioning last week about how public health needs history, I was thinking, hell yeah, it does. Now, let me explain how oral history has made a huge impact. There was a slide earlier that I shared with you from the Recover study here at UIC, and one of the co-principal investigators who you might know, Dr. Janet Lin, she connected me with Jenny to share my story one evening for a class last year. And Dr. Lin explained that the staff were struck by the experience of people living with long COVID and identified the need to make sure to learn and document and inform healthcare on how and what questions to ask. Despite how much I tried to avoid public speaking, I said yes. I was amazed that this course even existed, and I also wanted to learn how oral history helped us and future generations to shape policies that historically have excluded people with disabilities and complex chronic conditions. I was provided this set of questions from Jenny and the class, and I'm not sure if I told them that this was a very dark time during my recovery journey. It was over a year of endless suffering, and there were many nights I questioned, is my life worth living? I felt such a burden and failure to my kids, husband, and loved ones who have been an immense support to my healing. And when I read these questions, I poured my heart out. They felt like a lifeline. Earlier, I described how much loss I have experienced. Well, I've also had some gain. Aside from waking, okay, now oral history has allowed me to be vulnerable and authentic, and I discovered my voice. I'm done faking being well and trying to conform to an ableist society. I listened to various doctors and our healthcare system, who also misdiagnosed my mother when she actually, during my recovery journey, I learned she had ME, and this was back in the 90s, and she still continues to suffer in silence. I refuse to let it happen to me and my family again. And here's a reminder from last week on some important oral history tools and techniques from Jenny. And I included a slide from her lecture last week with a link here. And when I was grieving my former self, I was honestly thinking of becoming history, yet I saw the light when I was offered this opportunity to actually make history. And as my kids would say, let's go. All right, so with oral history, one can include pictures, objects, and such to help spark and preserve memories. Thank you, Yvette. She called this out for me and taught me about the term photo elicitation. I'd like to share with you a song that I played during my former consulting role. I played this for staff during my former life when I gave in-services and trainings during 2020. Especially for essential workers and frontline staff. Here it is. Shortly. So that was one of the songs I played. And do you recall when healthcare workers were praised at the beginning of the pandemic? We were actually known as heroes. This is how it started, and this is how it's going. Maynard is here. I want to give you a shout out and hello. I'd also like to give a shout out to the participant last week who was in Jenny's class. I didn't get a chance to write down your name, and you mentioned actually oh, are you here? Okay, someone mentioned last week to do this slide, actually, the oral history and this comparison on how it's going and how it started and how it's actually going. So the oral history clip that I'm about to play features Maynard Sasses, a registered nurse working the front lines who also became disabled by long COVID and associated diseases. I met Maynard when a dear friend, Sherry, texted me 2 articles from WTTW. Sarah Williams, UIC PhD student, is my partner for the Oral History Project, and we decided to highlight healthcare workers. Maynard describes feeling abandoned, forgotten, and watching his life go by. He too contemplated taking his own life, especially as friends thought he was exaggerating his symptoms. He's not alone. And note that he developed long COVID way before the vaccines were rolled out. This article also references the wonderful Dr. Krishnan, who leads the Recover study here at UIC, and confirms how long COVID disproportionately affects communities that are already historically disadvantaged. So here it is, a sneak preview to listening for the long haul. Please note that this is still in the process of being edited and finalized. And for context, Sarah asked me and Maynard to reflect on a link between what she saw with us healthcare workers sharing the first initial couple of months of having to navigate and negotiate the public health guidelines and what it was like being on the front lines. So here it is. I'm going to switch my screen again.
Oh, for sure. I mean, it was chaotic. I mean, what we saw in the news, was only part of it. Like if you were actually working, at the front lines, when I got it, like they were still rationing out, like gear, especially masks. And, unless you were working in the ER, they didn't think that it was necessary everywhere else, even though you're working in a healthcare facility like a hospital. It's just like, and it's a airborne, viral illness. Like you just can't, not take those types of precautions, or just assume things. But yeah, the understanding and like the direction was severely lacking at the time. I mean, I was fortunate enough at the time for my assignment that day was, the charge nurse that I was working with, I requested, a mask to help, to protect myself because, again, I mean, I'm not a doctor, but like I'm a healthcare professional and I know what the risks are, and I still wanted to protect myself. So they were supportive in providing me it, but, the reality of it was too, they weren't testing people at the time that were, that were asymptomatic. So unfortunately, the patient that I was taking care of, didn't present initially with the symptoms, but during the time I was taking care of them, it was obvious, that they were, that they were sick and something was going on. And until after, I took care of that patient, that I find out that, they ended up, being positive. They were transferred out. That patient was transferred out. Unfortunately, the nurse that, even endorsed the patient prior to me, became ill and she passed away. And some of my colleagues that I worked with that, that were also working with that patient, fell ill. A couple of them also are in the same state as I am. at this point, as far as, being severely disabled by, by their long COVID condition. So it's very unfortunate that, we lived at a time that, we couldn't have been proactive and, followed through with the obvious, misunderstanding of what was going on.
Well, thank you, Maynard and Sarah, for bringing that up. That does bring back a lot of memories. I can relate to you, Maynard, but being on the front lines, and I was actually in the long-term care industry during that time in March 2020, and we were wearing garbage bags as gowns. Yeah, and the masks, they were tearing apart. Surgical masks we had to wear it until
reuse it
we could. There was
Yeah.
nothing. I tried looking at stores or buying my own gear, but everything was sold out. And it was so frustrating. You're right. The asymptomatic, it was just spreading, and in nursing homes, and seeing it was spreading like wildfire. And I didn't hear anything about long COVID then, and so. Okay, so that's a preview of the oral history. And I would like to have an open discussion now about your thoughts. And my last comment before we do is disability does not mean that the hashtag hero to zero. I refuse to accept or believe that this is what happens when one becomes disabled. All right. So feel free to raise your hand or share in the chat. We're going to have a group discussion about the listening session and how you think of oral history and history. And please share your thoughts. So Katie or Emily, if you can help, the chat's going to pop up on my screen. If you can help.
I actually wonder, Jackie, if this could be a good place to take a 3-minute break.
Oh, sure. Yeah.
We can also just have folks think about this while we're breaking too, if that's all right.
Should I leave the screen out?
Interpreter is asking 5 minutes. 3 minutes is just not enough. 5 minutes, please.
Okay. Yes, sure.
Leave it up or take it. Should I stop sharing?
Here, I'm gonna actually you can stop sharing your screen. I'll text or copy and paste it into the chat.
Awesome, thank you.
Okay, Jackie, I think we're good to go whenever you want to resume.
Yeah, well, this is actually a group discussion. This is perfect to keep it like this before I share my screen. If questions are in this chat. Just trying to look at my windows here. So I just wanted to reflect with the group on what their thoughts are about the oral history and how can oral history be part of one's project or story. Thank you.
Oh, I can go.
Okay, great, thank you.
So one of the things I really liked about the way you told your history is it was really engaging. It felt like I was listening to a story, and I think that's one of the great things about oral history that you don't get from reading a history book. It's more engaging to the audience, and it personally makes me think a lot more than reading a history book.
Thank you for that. That was so kind. Thank you. And yeah, that's what I found out about oral history too. I actually like going to the primary source and really getting one's personal perspective.
Hi, Jacqueline. I'm Dolores
Yes.
Castañeda from Lido Village. And thank you for sharing your story. It's very, hard to hear. And then I want to make a comment about I live in Lido Village when we had a high index for people who died from COVID. And I always thinking in long COVID because a lot of people is still very sick about long COVID, but the situation with my community, they don't know how to navigate the system. And like you mentioned, sometimes people, the doctor deny you had long COVID. And I heard so terrible stories about people can walk no more, they can holding things like that for her COVID. And I'm thinking when you said oral histories, and maybe these people want to share the story about long COVID, and that way people understand is long COVID exists, because sometimes they say, no, it's not possible, thing like that, it's another condition. But thank you for sharing. It's very touching your story, and a lot of stories for people who has long COVID. Thank you.
Well, thank you. That was so sweet. And yes, definitely the stories, gathering their stories, especially those affected, especially Latinx, is 3 point. I don't have the slide memorized, but very highly affected those with ethnic minorities. So thank you for sharing that. And I feel what I've noticed with my experience for those, especially with language barriers, community access barriers, and like you described, having difficulty walking, it is very hard to even make it to an appointment. I've had to cancel several of my in-person appointments because I couldn't get out of bed. So thank you for sharing. And yes, I would be very, very interested if you are interested in starting any oral history projects with specific communities. And thank you. Thank you for that.
Thank you.
I didn't catch your name. I didn't get to see who was talking, actually.
Dolores Castaneda.
Oh, Dolores, thank you.
Yeah, thank you.
Thank you.
Thank you.
We'll take Sally next and then I'll head to the chat.
Okay.
Hi, everyone. My name is Sally. I use she, they pronouns. I'm a graduate student in sociology, and I loved this presentation because while I don't study COVID, I study public housing, but I use oral history in my methods, and I also have tried to do like activism around COVID on campus. So this was a really beautiful intersection to see. What I would love to hear more about, both from the hosts or from anyone else who would like to chime in on this. I know that something that I struggle with using oral history with public housing is navigating this tension between the power of oral history on one hand to memorialize struggle and loss, while at the same time, like, how do we leverage those strengths while not giving in to the dominant narrative of COVID as something that's over and in the past and behind us? How can we use oral history and still make it clear that COVID, like similar to like public housing demolition, is an ongoing structural violence and not something that happened only in the past? I wonder what others think.
Go ahead, Dr. Ford.
Okay, I was trying to wait to be called on, so thank you. Sally, thank you for that question. And I think my response would be, that's where analysis comes in. I think that it's our responsibility as people who are receiving these stories, like that people are being vulnerable and sharing with you. I think it's our responsibility to draw the connections to both where we have been as a society and also where we currently are and where we might be going. So I think my thought based on your question is that that's really an analysis question. That's a question of, what do we do with the stories that have been shared with us? How can we be good and critical stewards of these stories that have been offered, and how can we make sure that the vulnerability that was offered to us can be like put to good use, basically, to try to make a change going forward. So yeah, I think that you're really asking an analysis question, qualitative data analysis question.
Any others? I'm going to read from the chat.
And please indicate the time stamp so I can find it. Thank you.
At 6:28, Miriam mentioned, I think it can be a really powerful way of personalizing and showing unique different perspectives. It brings out the reality of history. Thank you so much for sharing your story. After that, Allison said, oral histories is so valuable for building community and advocating for change and raising awareness, especially around topics like long COVID, which are not openly discussed or are outright oppressed. Anne mentioned, I do some work in the reproductive health advocacy space, and I think oral history sharing has done a lot to persuade people over. Brittany Watts and Kate Cox sharing their stories and interviews have helped people understand why outright abortion bans negatively affect so many people. Claire also mentioned first-person narrative stories are important for connecting with each other and having empathy and understanding. Stephanie said, I'm curious if healthcare folks on the call can share who decides and how diagnoses are added into official medical diagnostic manuals. So that's a question for us here. Repeat the question. Stephanie is curious if any healthcare folks here or any people have an idea of how diagnoses are added into official medical diagnostic manuals. If not, I'll move on. A few comments. Lydia said, true, Sally. Oral presents. Tiffany added some thoughts. Marjorie, really interesting question. Janet, because there aren't many answers about long COVID narratives or stories, such as yours, may be able to help find answers. Rashida said, I work in public health in the housing and homelessness sector, and we do a lot of listening sessions at my organization. It is important to hear the voices and get the input of people who've lived experience in the area in which your programs are attempting to impact. Tambra said, can we put together a book on all or as many of the stories to be published? And Jackie nodded her head. Agosa said, oral histories are extremely important for people to hear, especially in healthcare workers and people at home who sometimes become desensitized to the tragedy and violence so prevalent in hospitals and on the news. Actually hearing a person's story and voice makes a difference. Thank you for sharing. At 6:35, Navaya said, when I was an MA, I believe we had ICD-10 diagnosis codes in EMR for long COVID. Allison said, I think oral history is incredibly important in healthcare and desperately undervalued. No one knows you and your health better than you, and I find that healthcare often forgets this. Rashida also said, stories humanize the data.
Sorry,
Katie?
I don't want to interrupt, but I just know we have a timeline activity that in the interest of
Yeah.
time, it might be good to
Sure.
move to.
Yeah, no, I was just reading, and that was great. And I think with all the answers that we gathered actually goes into our personal reflection. I'm going to share my screen now. And thank you everyone for your feedback. I love it all. And let me just see. Based on the chat, and thank you, Yvette, for doing that, helping that, and Katie. The self-reflection portion of this, also, I just wanted to ask people if there are any specific dates or events that matter to you. Because I'd like to now lead to, you mentioned the timeline. We're going to work on a project like getting started with oral history. This is what helped me during when I was learning from Jenny. And if there are any pictures, objects, music, or papers to include, and if you want to practice, write down a few example questions that encourages really long answers. Katie, how much time do we have for the self-reflection? Do we want to jump into the timeline or?
That's a good question. I guess we could do the timeline. I could post the self-reflection questions on the website for
All right,
people to
great.
revisit after class.
Yeah, and I'll have the slides ready for everyone that
Okay, perfect.
would like, yes. So for the oral history, when I was working with Maynard and Sarah and Jenny's class, my slide is not, okay. We worked on a timeline together and it's on Miro, and I'll get to that website. And so with the self-reflection questions, I'd like for everyone who's to share, we would like to put that on a template. And I'd like to implement what Jenny taught us last week about thinking like a historian and including the 5 C's. So if you can let me know if you can see this. And this is how we came together as a group and just put dates that reminded us of that were important. And if you want to share any dates specifically, it doesn't have to be necessarily about health or COVID. It can be anything. And again, it doesn't have to also go in chronological order. But here's an example. I started to put some dates. I opened the chat. Can you guys see it still? Or is this okay?
Like the bottom right corner. That's good. Yeah.
That's good. Okay.
So Jackie, what would be most helpful to hear from students? Would you want to hear about dates right now or stories? I guess like what's one of the first steps in this?
Well, the dates help, or even a topic. Anyone who would like to, who are thinking of doing oral history or would like to learn, starting off with even a general topic, and then the dates can come in. So for example, when we were talking about doing this activity timeline, October 7th is really a date that, when Hamas launched a surprise attack on southern Israel from the Gaza Strip, that might spark people to want to talk about that. Or most recently, March 1st, just 2 weeks ago, CDC changed the COVID-19 isolation guidelines. And it's really making it harder for people with chronic illness to even access the public and go outside without fear of reinfection. So any general topic or dates?
I could give a date to get us started.
Yeah.
On 12/25/2023, this past Christmas, my dad tested positive for COVID. And we had done so much family stuff leading up to that. So a lot of us tested positive in the next week or so. So kind of a big reminder for us all that COVID is still here with us.
Yeah, I'll put that here. And that is actually a recent. Thank you. Thank you for sharing that.
One of my,
Oh, yes.
I don't know the date. I can probably look it up, but there was different dates they're like the isolation guidelines change, but also like return to work, or some of these like restaurants closing, things of that nature, like people not having like access to certain facilities that closed. I don't remember exactly when all of this was happening, but I know that there was also like chaos around supplies early on, like scarcity mentality or mindsets.
Oh, early on, like in 2020.
Yeah.
Oh yeah, okay, here, yeah, scarcity mindset.
And I'm gonna mention it, right now I'm going to finish a mural. I hoping by May or June, I'm gonna have community members to come to the mural, because people who lost somebody through COVID, they always thinking about, it's very difficult not closing that part in their lives. And we start getting a mural about people who's died from COVID. Maybe
I
you
love
can
that.
share a picture even about it. Thank you.
Oh, thank you. You guys. I can't see it on my screen. Who has a picture? Yvette, do you know?
Yeah. I can try to put it into the chat, but Dolores is mentioning that she is leading a mural project
Yeah,
with adding the names of people who've lost
yeah.
because of COVID. And I'll try to add it to the chat.
Okay, great.
Annie, did you also want to say something?
Yeah, I went to a healthcare conference in February of 2020. And we had a speaker from the Mayo Clinic who I remember him saying this is the last time you'll ever be in a room with people and shake their hands. So I was just trying to think of things from like prior to pandemic status.
And this was in February 2020?
Yep.
Oh, wow.
Since we don't have to be on COVID, I have something that is a COVID story, sort of. On January 13th, 2022, my wife and I were out for a walk. We've never had COVID. And, we were kind of isolated for 3 years. And we would go out and walk 5-7 miles a day. And on January 13th, she fell on black ice, and our lives just changed overnight. And it's funny, I shared with her some of those animations because she doesn't have an infectious disease, but she's had some of the same side effects. I mean, I would have a very busy calendar if I listed everything, but she had 117 physical therapy sessions. Basically her knee was crushed from the fall. And she had been a yoga teacher and was able to recover range of motion, but the pain and disability never exactly went away. For a year, she couldn't climb the stairs in the house. We have a house with a lot of stairs. Now it's just painful to see her get up and walk around. And prior to that, we were jet setters. Now we've been confined to the Chicago area. Yeah, but we were going to Cambodia and Vietnam. And
Thank you, Howard. I'm sorry to cut you off. I know that a lot of us have had a lot of restrictions, so I know that we feel you on that. I wanted to also point to Fadia.
Yeah, I'll try to be quick. I think I'm trying to remember, it was April 2021. Most of my extended family lives in India, so like there's a time difference and just communicating with them is already difficult. And I remember during the pandemic, 3 different like households in our family all had COVID in India, and they didn't even know like that each other had COVID. And so within 48 hours, I think my mom lost her mom, so my grandma, an aunt, and a cousin within 48 hours. And when my uncle called that my grandma passed, that's when he learned that like his cousin and aunt had passed because my mom already knew about that. So just having that happen so quickly and so like it was a drastic loss in a lot of people. So that's just something that I think a lot of people don't face outside of a pandemic kind of era. And it just was a very, very hard time.
I'm so sorry to hear that, and I apologize, my sympathies for all of those who have lost, and we'll be sure to give information for those who want to participate in the mural, and again, my condolences. I know Marjorie added something in the chat around that where she was unable to see her grandparent because she had COVID at the time. And then others in the chat have recounted to Miriam on March 8th, the last day of March 8th, 2024, the last day you can get government funded COVID tests from UPS. I don't know if you'll be able to write all of these down, but Caroline mentioned on 7/26, her job's back to office day. And also mentioned New York Times article with the names of 100,000 COVID fatalities was in May of 2020, May 23, 2020. Tiffany gave the date of defending her dissertation. Congratulations. Even today, congratulations. April 16, 2021. And then I want to call on Lydia to ask your question.
Oh, sure. Thank you. It wasn't, it's not really a question. It's just my adding a date, but it like a little texture I feel like is needed with this topic. So I decided to raise my hand. In terms of life before pandemic, I noticed we had October 7th here. So I thought I would add 1948, which was the Nakba or catastrophe, which is when Israel began occupying Palestine. And I'm bringing it up because that's a personally and global event for lots of people, but also because it is, and a lot of people are thinking about this right now, so related in terms of eugenics and treatment of a population as disposable, the way we've been talking about treatment of populations, racialized and disabled populations in the US in terms of long COVID. And also they're both mass disabling events.
Definitely, there's a lot of overlap within some of these large disaster or epidemic type situations. So I know that there's some more that have been named in the chat, and it may be a little bit too much for us to add at the moment, but we really appreciate the participation. Jacqueline,
Yeah.
I want you to tell us what happens next. What
Yes. So usually for those who are interested in oral history, this is a start. For those who start thinking about it and dates, this can help either whether you want to share your own story or do an oral history, as Laura's mentioned, on others who can benefit from it. So this is a great way to start. And to help formulate questions. So I'll have the slides available. And is there any last minute questions? Let's see. I have a recap slide here for those for note taking and the timeline. This is for notes who would like to start an oral history. And I listed the 5 C's that Jenny mentioned last week. I do highly recommend the book, The Long COVID Survival Guide. This has been a wonderful resource and lists many of the topics that I've covered. And I just wanted to thank everyone again for being here today. And Long COVID Awareness Day is tomorrow. So thank you all.
Could you go back to the summary slide?
Yeah. Was it this one? Or the activity?
Yes, this one. Thank you.
Okay, great.
Thank you
Yeah.
so much.
Thank you. Thank you, everyone. And this will be available for a note take for those. And I have a link to History Moves, oral history on HIV.
Jacqueline, I don't know if you see it, but you're getting a lot of love in the chat. People are saying how much they enjoyed this session, so thank you.
Oh, thank you so much. Thank you, everyone. Thank you for being so supportive.
Thank you. And for those who added to the chat, we'll be sure to add to the timeline and upload it to the site. So thank you, everyone, and a lot of thank yous in the chat.
Thank you.
I just want to remind everybody that tonight after class, we're having a potential student info session, so please stay for that. And just some quick updates, there's no class next week. It's spring break. And then the week after that, the class will be available for students that are taking the course for credit. So it will be a smaller section for those that are registered. If you're looking to engage in the weeks that we're off, please make sure to check out our website and check out the recordings and the past lectures. And we'll welcome you back in class will resume on April 4th. So for the students, please go to the Blackboard Zoom links and click on Zoom for the link for today. And then for everyone else, please feel free to stay to learn a little bit more about the school.